Good morning, everyone, and thank you again for the media entities that are here, from TV to radio to print. We appreciate that. To our lovely sign language young ladies, thank you very much for being here. We appreciate that. Just saw you on with the governor the other day, too. The surge continues. Friday, we had 128 testing positive. Saturday, 137. These are historic numbers. Sunday is 30, and Helen and I hope and pray it stays at 30, but we doubt that. There's always adjustments made. So basing it off those current numbers, the weekend total was nearly 300, 295. Which would be historic. The week was historic in nature, 646 that tested positive. That brings our total cases from when this ordeal started back in March to 5,285. We are again very, very appreciative that Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer for Mercy Hospital Trinity Healthcare, are always here on our Monday briefings, and more importantly, that we continue to coordinate on the surge that our hospital capacities can continue to put across the great services that they've been putting across to our residents in need. The deaths, thank God, knock on wood, have stayed at 133. That's been pretty consistent for a while now. Hopefully it stays that way. White would be 57, about 43%. Black would be 31, 23.3%. Hispanic would be 43, 32.3%. Asian would be 1.5%. In turn, the long-term care facility deaths are 57, residential 76. And again, our thoughts and prayers and encouragement go out to all the affected families. We continue in working very closely with AMR. Governor Baker stopped the spread, and Patrick Leonardo, the Director of Operations, is here, and we appreciate their continued efforts to ramp up testing. Senior meals continue to be delivered to our seniors who are in need. Flu shots, and again, I can't say it enough, please get your flu shots. Flu shot availability is there. Also, I'd like to say to the Congress, residents and business community are hurting. You've had a stimulus package before you for months, and we're going into this surge. So people, residents, businesses continue to struggle, and I urge you again for Congress to move on this stimulus package, because if adjustments have to be made as far as what needs to be done in cities and towns, that means people might be out of work. That means businesses are going to adjust. The bottom line is that means people and businesses are going to be in need. So while in Congress you can be philosophical about it, mayors and governors have to act. So again, I urge you to move on this stimulus package ASAP for the residents, the business community, and governmental entities who are continuing to provide day in and day out. So please, put some differences aside and get this goddamn package done before we lose more people and lose more businesses. And I'm sorry to be so blunt, but it's gone on for months now, and this surge continues. Speaking of the surge, the Oasis Food Bank, and I want to thank John Foley and the Food Bank of Western Massachusetts. Central High School, every Friday, I want to thank DPW and police and fire. Every Friday we're feeding 3,500 families. Every Friday. Meats, milk, fruits, and vegetables. We had some good news. Neighborhood improvements are very important to me and my administration. That monstrosity of MCDI is finally coming down, being demolished. At one time, during the legendary days of Frank Gallooni, he helped out thousands and thousands of people at MCDI get back on their feet. Unfortunately, that went by the wayside, and that's being demoed for the improvement of the neighborhood, and in the Barry Homer Street School subset, and the Sam Bolden Park is going to be going there. I had a pleasant Saturday afternoon with Zelma Williams, 90 years young. They had her birthday, a little drive-by on Waldorf Street. She was the first African-American pharmacist ever in the city of Springfield's history. She writes great editorial letters, and her family and invited me, and it made my day that Saturday afternoon to be able to present a proclamation to her. So, Ms. Williams, I said to you Saturday, Buono Compleanno, happy birthday in Italian, and Chindan, I'll be there for your 100th. School committee and Superintendent Warwick will get more into that, but we did vote to honor the late coach Kamari Williams, to name the gymnasium after him. On the public safety front, Commissioner Clapprood and I had a very good meeting. U.S. Attorney Andrew Lelling and Chief FBI agent from Boston, Joseph Bonavolanta, came to my office, and we met to increase our gang task force activities to get these individuals and guns off the street and make federal sentences. It seems that our state courts are becoming a revolving door, letting these repeat violent criminal offenders out. And we had a good meeting updating on our DOJ, our continued actions to address the DOJ report with Solicitor Bakula. Commissioner Helen Carlton Harris and I continue our meetings. We met with street outreach workers late last week, and our continued efforts to, we'll announce very shortly, intervene and mediate with these gang and gun and drug issues, and working with the police department, but mainly to be on the streets. Continue our mental health outreach. Commissioner Clapper and I met with BHN officials late last week to look to continue to expand mental health outreach, going out with our police officers. About 34% of the time it's mental health. It is not a criminal activity, and we don't want it to rise to that. So we're very appreciative of that. On the police front, and Commissioner Clapper will update you, but she's down 20 with COVID-19, 20. Another 5 pending, so really 25. We have put, Commissioner and I have put state police on notice. We might have to call in the state police to help us. We have a great partnership with them. They're on standby right now. Commissioner Strategic will speak to you. She has moved to one-man, one-woman cars now. The academy has been affected also. The academy might have to move to remote learning. And again, our narcotics, and I have to tell you, under the direction of Captain Brian Keenan, last couple of years, the Commissioner Clapper has completely revamped narcotics. Major raid was made with narcotics and DEA. She'll speak to you that. Over 101,000 bags of heroin, 4 guns, $40,000 taken off the street. She'll expand more on that. Fire front, Commissioner Calvi indicates to me we're down 1, but 5 are awaiting testing. So if that puts a little strain on him if those individuals end up going down. 3 in dispatch and 2 probable, so we're making the appropriate adjustments, and we're going to work with Commissioner Helen Carlton Harris and AMR on some targeted testing. Superintendent Warwick indicates to me we're well over the 4 million mark, 4.2 million plus in meals served, breakfast, lunch, dinners, snacks to our students and families. nearly 98,596 this weekend. We continue to work on reviewing and work efforts with our school buildings, preparing them to be ready to go when and if we deem it public health-wise safe to get our kids back in class. The town hall meeting we're looking to have as soon as possible. Focus Springfield's in the midst of transferring and new equipment, and we're looking to do that as we did before to let our families and students know how we're going to move forward. In turn, I'm going to do the same thing with which would be my third or fourth community police relations town hall meetings, but we're waiting for Focus Springfield. Again, they're in the midst of transferring equipment to do that. Flu shots continue with the school department. Director Signoli from DPW indicates to me that they're down one with COVID-19. Yard waste, again, there's been a tremendous amount of yard waste put out there, and they're a little bit behind, so be patient. DPW is in desperate need of snowplow drivers, CDL, and mechanics for anyone out there. We're in desperate need of that. And Director Signoli will give you an update on that radioactive material that they continue to trace and monitor, but I'll let him update that. On our finances, Chief Administration Financial Officer T.J. Plant indicates to me we've deficit spent about $6.7 million. I'm down about $1.7 million for FY21 this year, lost revenue. Last couple of weeks, lost revenue about $871,000. We, between deficit spending and grants, about $11 million for our residents and business community in need. Grants, we offset about $6.5 million deficit. A lot of that money is going to the schools and our municipal building improvements to go above and beyond the Mercer and the COVID-19 requirements. Parks and Facilities, Patrick Sullivan, COVID-19, his team is down 7. Building work continues. Orders are in for the I-ways and all the carrier units, so we're going to be putting those in very shortly. The Sea Arena, again, will stay closed. All interstate hockey has been postponed anyways via the governors in the area, so Sea Arena will stay closed. We'll reassess in the near future. Echo Dev, Director Tim Sheen's done a great job getting money out to our businesses and our residents. Nearly $10.5 million has gone on entitlement and CARES Act. About $4 million or so CDBG, ASG, home funds. Small business loans are starting now with Common Capital, and again, besides the businesses, we've also put $2 million out for residents who are having difficulties paying their mortgages, utility, and rents. Solicitor Pakula, again, the law, HR, labor update, standard update, Attorney Bill Mahoney with HR and labor. Working with the health department, we're going to start to look at targeted weekly testing. So with that, I'm going to, again, bring forth Dr. Mark Kerouac, the President and CEO of Bay State Health Systems, and then Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, to make their important presentations. When they are done, so they can get back to their respective medical establishments, we will take questions immediately from the media at that point in time. Dr. Mark Kerouac.
Good morning, everybody, and thank you, Mr. Mayor, again for holding these events and for the opportunity to speak to the citizens of Springfield and beyond. I appreciate also the cooperation of your team in battling this pandemic. COVID-19 continues to increase across the world, across the country, and across the state, and it's speeding up. The United States has passed 11 million deaths, 11 million cases, and 246,000 deaths. We're consistently seeing over 100,000 new cases each day, and 15 states yesterday sent records. Deaths continue greater than 1,000 a day. Many hospitals in the upper Midwest and in the mountain states are at capacity. Massachusetts has gone beyond 182,000 cases and 10,000 deaths. Hospitalizations have increased twofold in the last month, and deaths are up about 30% over this last time. This rapid increase has come home to Western Massachusetts as well, and to Bay State Health. At the beginning of November, Bay State Health had about 40 patients across the system. Today, we're at 88, more than double in just 2 weeks. There are 77 at our Springfield campus, 11 in our community hospitals. 8 patients are in critical care, 14 require intermediate care. We've entered a phase of exponential growth. Our testing capacity has been reduced somewhat to about 600 a day. This is due to competition across the country for the reagents required to run these tests. We believe that we'll get back to our capacity of 1,000 a day and hopefully extend beyond in the next few weeks, but we're undergoing a temporary slowdown in the rate at which we can test right at a time when the case numbers seem to be mounting. We have no issues with personal protective equipment. Because of the surge, our incident command team has begun meeting daily, and there are regional groups of hospital leaders that are meeting on an ongoing basis to plan for bed expansion. As I've mentioned previously, we can go up to a little more than 100 beds without closing down any elective procedures, and at the Springfield campus to about 300 beds if we were to discontinue elective procedures as we did last spring. There's no signs of any spread among staff or patients at any of our hospitals. It's therefore safe to come in for regular care. One other thing I wanted to mention today, one other major constraint is the issue of staffing. Bay State Health has 12,000 employees in about 90 different locations where care is either delivered or supported. Before the pandemic, just as a result of normal job turnover, we had about 600 openings. Today we have 1,500 openings. Many people have decided to retire early. Some have left work because of childcare needs or caring for parents. Others have had to do homeschooling and have been unable to continue in their work. Many have just decided to find something else to do. The people who are on the job today at Bay State, those who have stepped up and still step up, are to me the true heroes in this fight. They've been in the battle for 8 months now. They're tired, they're stressed. Many of them are afraid for their families and for themselves, but they're still committed. We cannot allow case volumes to double every few weeks and expect that these hardworking individuals will be able to be there for everybody. Beds don't take care of patients. Healthcare workers take care of patients. I rounded last week on one of our COVID units that today has 39 infected patients in it. And I saw patients who were afraid, gasping for breath, restless. It is maddening for me to see people argue that this is not a real disease. People are suffering and dying of COVID-19 today, right now, in our city. And the people who are caring for them are showing real courage. They are doing their job. It's now time for the rest of us to do our job and prevent the further spread of this virus. It's the usual set of behaviors we've been talking about for weeks. It's masking, social distancing, hand washing. It's important this year to keep Thanksgiving virtual, or if not virtual, small, less than 10 according to the governor. Please follow the guidance that we've talked about before regarding planning, ventilation, masking, distancing, food distribution, etc. This is a critical time, and we all need to step up and do our part, or we may not be able to take care of everyone who needs us. And that's a horrible thing for me to have to say. There has been one additional bright light come up just today. the Moderna vaccine, another Massachusetts-based vaccine manufacturer, is making the news. 95% effectiveness in a trial of about 30,000 volunteers, and a truly representative trial in that they had 9,000 minority groups, about 5,000 elderly individuals, about 3,000 individuals with chronic conditions. 95% means that of the 15,000 people who got the vaccine, only 5 got the infection, whereas the 15,000 who got the inert placebo, 90 got the infection. Tremendous effectiveness. They are not reporting any serious safety issues right now, but they still need to have their data reviewed by the FDA for the vaccine to be approved. The advantage that the Moderna vaccine has over the previously effective Pfizer vaccine is that it doesn't require any special refrigeration. It can be kept in a household refrigerator in the freezer part. So that's 2 vaccines. But remember, the vaccine is not the sole solution. Moderna has 20 million doses already developed that they are earmarking for distribution in the United States. And if the FDA approves, that could begin in later December. Pfizer has 50 million doses that they've produced. That's promised to the entire world, again, to be distributed by late December. But we need billions of doses of this vaccine, and therefore the distribution will be in a tiered fashion. High-risk individuals, frontline caregivers first, followed by individuals with other medical problems, then followed by the general public. It will likely be well into the spring before an average person is going to have access to an effective vaccine, and therefore we don't want to simply hang our hopes on the vaccine. We need to do the protective measures so that we are not seeing deaths mount and mount as they are right now, and the health system becoming overwhelmed. So please follow the guidelines. Masking, social distancing, hand washing. Get your flu shot. None of these is a guarantee of safety, but they greatly, greatly lower your risk. We can maintain the mindset. I wouldn't say maintain because we're not maintaining it. If we could acquire the mindset of acting like a community and being responsible, each of us, for the welfare of all of us, we can keep a lid on this current surge until we get to that bright light of having a vaccine and get rid of this thing once and for all. So thank you for your time today, and thank you again, Mr. Mayor, for the opportunity, and I guess I will turn it over to Dr. Roos.
Thank you, Dr. Kerouac. Dr. Robert Roos, the Chief Medical Officer, Mercy Hospital, Trinity Health.
Thank you, Mayor, and to your entire team and to the media for continuing to report out on these important updates. Unfortunately, my update this morning on the state of the pandemic is not any more optimistic than the one that you heard from Dr. Kerouac. In fact, with each passing week, my concern grows greater than the week prior. Here in Massachusetts, even though I think it's safe to say that we have been in a better position for much of the summer than many states, we are right now still unequivocally heading in the wrong direction. When we look at the data here and across the country, the concern is that the spread of the virus, to put it frankly, is beginning to spin out of control. When you look at the charts of new infections per day, we are seeing them rise more rapidly than we have ever before across the country. This third wave of infections that we've now seen has a steep ascent that's higher than the first or the second waves. There's now been more than 11 million confirmed infections, and we went from 10 million to 11 million in just under a week. Hospitalizations are steadily increasing, and even though the rate of that increase is slower than the numbers of new infections, the total numbers of hospital cases across the country are breaking records day after day. There are hospitals in many states across the country that are reaching their own capacity. There are health systems that are making the very difficult and impactful decision to suspend or limit what we know to be critically important care. And even now, 10 months later, with improved treatments, we're still seeing 1,000 patients die each day across the country. The reality is that we've seen 250,000 people die from this disease, and estimates could project another 100,000 even by the end of the year, which would be frankly unacceptable and tragic. But we have the opportunity to do something different about it. We have the knowledge, and we have some tools and resources to help tamp down this spread. We know that from our experience here in Massachusetts, actually, where we did a very good job, not a perfect job, but a very good job in tamping down spread in the late spring and throughout the summer. But a look at where we are now compared to where we were at our lowest observed values tells a strikingly cautionary tale. This past week, the rolling average of new infections per day in Massachusetts is about 2,000, which is a 1,000% increase from where we were at our lowest point of 157. The test positivity rate is up to 3% when factoring them all in, and when taking out the tests that are done for higher education, it's up above 5%. And that's 3 times more than what it was at its lowest point of about 0.8. Hospitalizations are now up to over 660, which is 4 times what it was at its lowest point of 155. And the daily numbers of new deaths has doubled from the low point of 11 to now over 20 per day, fairly consistently. At Mercy Medical Center, the last few weeks have also brought rises in cases to our emergency departments and our hospitals. This morning, we have 19 hospitalized patients with COVID, and we've had as many as 24 within the last week. We've also seen our test positivity rate increase to over 6% now for 2 consecutive weeks, having tested nearly 3,000 people last week. We are identifying more positive tests in our emergency departments than we have since the first surge. We're picking up more infections in our pre-procedural testing than we have since we resumed all types of procedures. We're seeing infections amongst all age groups, and we're seeing concerns amongst clusters of infections in certain industries. Having one corporation sending us over 40 individuals for testing just this weekend because of concerns of an outbreak. This validates the importance of testing, but it also is clear evidence that the community spread of this virus is actually more rampant now than it was in the spring. And if we don't take significant action, the concern is that we will only get worse. That's how the virus works. The virus goes from 1 infection to 2 to 4 to 16, and it can happen very, very quickly. As an example, the CDC published another one of its examples and lessons in the MMWR of how a well-intentioned family gathering can be an unintentional super spreader event. That event can lead to explosive growth of infections, it can lead to sustained transmissions, and it can lead to serious illness and death. Back in August, there was a report of 2 infections of SARS-CoV-2 in a small town in rural Maine. When doing the contact tracing, it was found that both those infections could be traced back to the same wedding that had happened 5 days before. Now, at that wedding, there was one person who had no symptoms, who had no knowledge of being infected with SARS-CoV-2. But amongst that wedding, where there were 55 people, 27 of them ended up acquiring COVID. An additional 1 employee, 1 vendor, and 1 other person who was eating in the venue, that was both an indoor and outdoor venue, ended up contracting the virus. And then what happened is those 27, or actually 30 people, went about the rest of their life not knowing that they were exposed or infected. So they went back to their school meetings, they went back to work, they went back to their own families, and sometimes in other states. And in one of those cases, somebody that was infected worked in a correctional facility. In another case, someone who was infected gave it to one of their household family members who worked in a long-term care facility. And so over the course of just a couple of weeks, that virus went from 1 to then more than 80 people in a correctional facility, inmates and staff alike being infected, more than 38 in a long-term care facility being infected. And in total, trace back to just that one person at a wedding, 177 people infected, 7 hospitalized, and 7 dead. None of the people that were hospitalized or died from COVID were at the original wedding. None of them. This example highlights several things that are incredibly important today and will remain important over the next several months. Large gatherings like weddings, birthday parties, church meetings, holiday gatherings can inadvertently have the potential to be a super spreader event. Even if the people in the environment may not be considered high risk or concerned about the potential for spread, they all interact with other people in the community, and they will over the course of days or weeks, and it can create a very serious situation for those that are most vulnerable, disproportionately impact amongst our communities. The risk goes up, of course, if there's not masking or physical distancing that's adhered to 100%. It goes up if the events are indoors. And this case also reinforces how important it is that people don't go to work or go to events or gatherings if they're feeling ill in any way at all. When traced back, the one person who worked at the correctional facility did in fact go to work for 2 days, not feeling particularly well, with a mild cough. And the person that went to work at the long-term care facility had a headache and had some mild symptoms that were thought to be nothing or much more than a common cold. So it tells us that we must follow these guidelines, even if we think we're in situations that may be safe. They have the potential to spread and can impact the most vulnerable amongst us, even in communities where transmission is low. That rural community in Maine was a community of only 4,500 people and had not reported even one COVID case prior to this wedding. And right now, we're in a situation where many communities have much higher rates of transmission, have incidence rates over 20 per 100,000, where the baseline levels of people infected is much, much higher. So I implore you all to think about this as you plan the holiday gatherings over the next several weeks and months. It's important for us to connect with our loved ones, but it's just important for us to think about how we can do that safely, so we don't unintentionally create an event that could lead to a chain of events that ultimately could impact others. That means think about limiting your gatherings. It means thinking about ensuring that people that you may interact with have isolated prior to that gathering. It thinks about whether or not you can get tested prior to that gathering so that you can keep you and your family safe. And when possible, do things outdoors as opposed to indoors. And always be masking and keeping distance at the appropriate times. At Mercy Medical Center, as we're entrusted with the care of you in our community, we think about this every single second of every single day. We want to ensure that we always are providing safe care for you. And we've reinforced all the protocols that we've put into place since the beginning of the pandemic for us to be able to effectively do that. We continue to check temperatures at the front entrance. We continue to require masking in all areas. We've continued to look at how we can redesign the areas within our hospital to separate people, particularly when they're gathering on breaks or needing to eat a meal. Out of an abundance of caution, we've also made the difficult decision recently to return to our visitor restrictions that we had in the early part of the pandemic throughout the entire region of Trinity Health of New England, where we're not allowing visitors unless there is an exception like maternity care, pediatric care, or in certain situations with exemptions. Our Incident Command Center has also recognized that this is a time where information is changing frequently and decisions are made frequently, and we've increased how often we're meeting as we prepare to open up additional units to care for patients with COVID. Right now, we have 2 units that are open. We're ready to open up a 3rd, and we're expanding our ability to test from about 400 per day to 500 or 600 over the next few weeks, including some rapid testing in our emergency department for symptomatic patients. With that, we are prepared to continue providing all the important types of care to you, including elective procedures, including studies like mammograms and chronic disease care. We're committed to doing it safely, and we're committed to communicating with your loved ones during those times if you're not allowed to have a visitor. But I want to recognize also what Dr. Kerouac had mentioned, the concerns about staffing and the concerns about our colleagues who have been caring for the community since the very beginning. With the rising rates and numbers of infections, we too are also preparing for the worst. We've developed plans in a tiered fashion that if we needed to scale back on certain things, we would do so in order to preserve staff in our resources. We know that in this second surge, we won't be able to pull staff from other states or other locations because all states are being impacted with a surge presently. So I encourage you to take the steps that will help protect our staff, help protect our resources, so that we can always be there to provide care for you. Even though there's been positive news in regards to a vaccine in the future and some news regarding monoclonal antibody treatments for mild or moderate illness, neither one of those will deliver us from this pandemic in the immediate future. We need your support to preserve health, to preserve our economy. And so I encourage you to recognize, as I've said before, that the community members, all of us, really are the front lines in this pandemic, the public health agents that can help prevent the spread of this disease. We at the hospitals and in the healthcare system are the last lines of defense. We will be here for you when you need it, but we need you to take these efforts seriously. So please, think about and take action with masking, distancing, being cautious about your gatherings and where you go, and staying home and isolating if you're sick. Please support those around you with doing the same so we all can enjoy this holiday season. Thank you.
Thank you, Dr. Roos. Now, Dr. Kerouac and Dr. Roos will take any questions or comments you might have. Paul?
On Friday, the governor announced that National Guard is a field hospital in Worcester, and they're looking at other sites potentially around the state. Do you think Western Massachusetts needs a field hospital? We didn't have one in the spring, but do you think, seeing what you're seeing now, are we going to need one?
Yeah, we actually declined one in the spring. We are not the biggest fans of field hospitals, primarily because it's not efficient to split your staff into two separate locations if you can create beds and create capacity on one site. It allows you to take care of patients of all stages of the illness, from mild to severe, and not have to think about who goes where and what scarce resources go where. So from a staffing standpoint, we're going to try to avoid having a field hospital here if at all possible. I don't know if that is going to be possible, though, because we're at a point right now where we're rapidly rising, and I don't know where the peak's going to be.
I have nothing else to add. I would agree.
Eric?
How would it work with two different vaccines now?
I mean, I'll take either one if they work, right?
Yeah, I think at this stage, we are both, heartened by the fact that there's been two major manufacturers that have released initial data from their phase 3 trials that have shown an effectiveness rate that's 90% or higher. That's very promising. Neither one has yet to file for an emergency authorization, although I would expect that that's coming in the next few weeks based on what we've heard. Ultimately, once they become available, we will be looking as a system about how do we look at the data first and foremost to ensure that it's safe and effective, and then how do we deploy it appropriately in an approach that targets people at risk first. If you have more than one vaccine, that can certainly create more opportunity for people to receive a safe and effective vaccine earlier than you would if you only had one. So I think still yet to be seen on how that will all be distributed and implemented, and how some of those decisions will be made with individuals, as well as how all that will happen. But over the next few weeks, I'm sure we'll learn more, and then hopefully in the coming months, that'll become a reality.
I just point out that for most vaccines, there are multiple manufacturers. Flu vaccine, there are a handful of different ones. And having that kind of redundancy and that ability to expand supply is good in terms of getting it out there quickly.
Nick Oresco, anything?
Obviously, good news about the two vaccines. If successful, how long do you think the public needs to continue to wear masks? Obviously, of course, those vaccines are successful or not, but how long do you think, public-wise, masks can be worn?
I think the masking is going to be based on new case volumes. So if 60, 70, 80% of the population has gotten their immunity, we're going to see case numbers crater, really fall quickly. And then I think the pressure will be on public health authorities to back away from the masks. But it's going to be case numbers and not vaccine distribution that's going to drive that.
Agreed. Go ahead. Yeah.
Dr. Newman, if you want to respond to this, I know that the remdesivir has a multi-day course on it, and I've been reading some areas where there are people who basically responded already well before the course is over, but they have to remain hospitalized sometimes. But I've also heard, I can't remember right now which hospital it was, but somebody who was from one of the hospitals in Connecticut speaking of that Governor Lamont's press conference talked about how they were sometimes doing like they're trying giving somebody remdesivir and then letting them go, you know, and kind of like monitoring that way. I wasn't sure if you could respond at all to how that might be clogging some of the capacity at hospitals, or if there is any talk about maybe giving people that dosage and then letting them go home and just monitoring them. Speak to that at all?
Yeah, remdesivir has been shown to be as effective when given 5 days, for 5 days, as the original recommendation of 10 days. Is it possible that some smaller number of days would be as effective? I guess, but the study hasn't been done yet. The key thing about giving it in the home setting is that you need to carefully monitor somebody's oxygenation and be willing to get them back in the hospital if indeed things got worse. But you know, this is all kind of new stuff, and so the possibility of home-based infusions, I'm sure someone's going to be exploring it at some point.
I would just, the only thing I would add to that is it is not something that's, you know, come to my attention that this is creating a capacity issue. As mentioned, remdesivir can be given for 5 days. We're giving it to patients that have an oxygen requirement in a hospital, and typically those patients would remain in the hospital for that duration of time. So it's certainly possible that that might shift, but I don't see that causing any of the concern at the moment in our experience. Yeah.
And in terms of you mentioned in the Derma study that they've had information about, you know, a much broader sense of who their test subjects were. Do we safe to assume that if we've got like 9,000 people of color, 3,000 people with chronic conditions, that they're roughly evenly distributed between the placebo and the vaccine, since it is a double-blind study?
Yes.
Eric?
As we spoke a little bit about hiring of that base rate, are you guys at the moment, are you short staffed? What's happening at the hospital?
Our staff are stretched. There are some areas where they're overextending, they're having to work overtime hours, extra shifts, that sort of thing, and that just adds to the stress and strain. And so we have 1,500 open positions, and we, you know, if qualified people showed up tomorrow, we'd fill them all.
Yeah, so right now we have capacity for both COVID and non-COVID patients without making any changes to the existing services that we have. So we have adequate staff to provide care for the community. The concern about staffing is that our staff have been through a tremendous amount over the course of the past 10 months. We have also seen trends where staff are leaving the workforce. There's been some prominent articles about physicians who have decided to retire early, or nurses who have done the same. And what we're seeing is that there's a smaller supply to pull from as demand in the overall healthcare system goes up. So we're taking an approach where we're really investing, as are other systems as well, in building that resiliency amongst our current workforce to be able to support them through this. But I think it's something that globally there's a concern that as the healthcare system is dealing with this impending and current active surge, that we need to protect this resource.
Any other questions or comments for Dr. Kerouac or Dr. Paul?
Back to the subject of the vaccine. I know that there's been discussion about prioritizing the distribution to medical personnel you get to the general public, there's been some concern expressed about this arrangement that the federal government has made apparently with the drugstore chains for distributing it, and the issue being that there are a lot of these stores located in low-income minority communities. Do you have a comment on that, on how this distribution is handled once we get to the general public?
I think we're going to need to be very conscious of how difficult it is for someone to get to a distribution site. I believe that certainly in the city of Springfield, we will be distributing through all of the various places where people get routine health care today. So that will provide us with good coverage, and it would be likely that we would be setting up other drive-through or walk-in centers, very much like what we've done with testing. So I do think you need to be thinking about, okay, if such and such a store is going to distribute it, how does that solve your geographic coverage issue? And I think to your point, it might not, and you might have to do extra distributions.
Thank you. Any other questions or comments? Eric?
I know in some states they're letting employees who are tested positive or asymptomatic still work with patients. Does Mercy and Free State have any intention of doing that?
Can you say that again? I didn't.
There's some states that let employees who are tested positive for COVID but are asymptomatic still work. Will Bay State and Mercy use forever doing that?
We have not considered that as yet. I'm aware that some of the states, like the plain states and the mountain states, where they're really, really short and people have no symptoms, they can go back wearing a mask. That is consistent with the guidelines, but we have not gone down that road yet.
We have not either.
Any other questions or comments? Last thing I'll say with Dr. Kerouac and Dr. Russo, I deeply appreciate their time and efforts, is that I'm heartened that President-elect Joe Biden has indicated he is going to invoke the Defense Act on it, which we had screamed for. We screamed for 8 months ago about the Defense Act must be invoked to get the equipment and to get the things that you need, the agents, which we're still struggling now, whether it's hospitals, whether it's governors, whether it's mayors. So I'm heartened. That needs to happen yesterday. And I'm also heartened there has to be a federal game plan, national game plan, which was missing. And having hospitals and governors and mayors going on their own. So we got to be all on the same page here. But the Defense Act, maybe that'll help with some of the shortages that you're going through. It should have been invoked 8 months ago. 8 months ago on it, because now people are losing their lives, businesses are closing, residents are hurting. So Congress, please get off your behind and pass that stimulus act so we can continue to move forward. Dr. Kerouac, Dr. Roos, thank you very much.
Thanks.
We'll now have our Dr. Anthony Fauci, Commissioner of Health and Human Services, Helen Carlton Harris, make her presentation. And please, once again, heed her advice. I'm sorry to be so forceful or emotional, but you're talking about people's lives and people's livelihoods. And that's why there has to be a pronounced attack, a uniformed attack, coming from the federal level on down. Again, mayors and governors and others, we're on the front lines. We're on the streets. We're the providers. We need the government. We need Congress to put aside their differences and start to get something done. Commissioner Helen Carlton Harris, please.
Thank you, Mayor Sarno. Appreciate you. Thank you very much for being here one more Monday. It has been said over and over again, we in the Commonwealth of Massachusetts and this nation are in a surge. We are seeing unprecedented numbers of COVID-19 positive individuals. The city of Springfield, as the mayor said to you, has hit an all-time high since this pandemic began In 1 week, we have 646 cases. And that number for this week is going to grow because each day we report a number, the next day additional cases come in for the previous day. So that 30, while it may look as though it's good news, it is going to change. Last Sunday, I reported 23. That then turned into 81. So this week on Monday, looking at the confirmed COVID-19 cases, November 9th through November 15th. And you can see the case numbers: Monday 86, Tuesday 34, Wednesday 115. That's when the mayor sounded the alarm and said, we've seen the highest cases ever. And then the next day, we had 116. The day after that, 128. The next day, Saturday, 137. And then Sunday was 30, but that again is going to change. The confirmed COVID-19 cases weekly comparison chart. As you can see, each one of those days, the number has gone up. And again, that number will go up for Sunday. And so the 646 number I'm reporting is the highest again, but you can see the trend over time. The trend over time is not good. Next, let's take a look at the confirmed cases by age group. By age group, you can see that the 0 to 10, 66 positive cases in under 10 years old, 105 cases 11 to 20 years old, 131 cases 21 to 30 years old, 112 cases 31 to 40 years old, 62 cases 41 to 50 years old, and 69 cases 51 to 60, 51 cases 61 to 70. That 51 to over 50-year-old age category, those are the age categories that we could potentially see as hospitalizations. So we know that the average age of hospitalizations in the Commonwealth of Massachusetts right now is age 67. And so you look at that 51 to 90-year-old age group and know that the potential for those individuals is that they could potentially wind up hospitalized. If we take a look at the confirmed cases by age group, again, 30 and under is 47%, 31 to 50 is 30%, 51 and older is 23%. Looking at the zip codes in the city of Springfield, you can see what the zip codes represent. The highest zip codes, 01104, 122 cases, 01108, 135 cases, 01109, 136 cases. But the next chart will show you that every case in the city of Springfield, every zip code has increased. But let's look at it by percentages. We're looking at that where it says confirmed cases, the pie chart with the percentages on it. 01109, 21%, 01108, 21%, 01107, 9%, 01104, 19%, 01105, 7%, 01118, 8%, 01119, 6%, 01128, 1%, 01129, 3%, 01151, 3%, 01101, 1%, and 01103 is at 1%. Taking a look at the confirmed COVID cases by zip code, again, You can see the increase in the numbers. Every zip code, with the exception of 01151, has increased over this period. So what we're seeing is a lot of infection, community spread in the city of Springfield. I took a look at the 3 weeks that I've reported to you and the numbers in each one of those zip codes. So for the last 3 weeks, 01101, you've had 12 cases, 01103, 9, 01104, 264 cases in the last 3 weeks. 01105, 101 cases in the last 3 weeks. 01107, 141. 01108, 248. 01109, 289. 01118, 109. 01119, 94. 01128, 22. 01129, 51, 01151, 53, and we had 3 that were unknown. Taking a look at the cases by race, this is just last week. Unknown, which means there were no race that was identified by the data. White, 27%, Latinx, 28%, Black, African American, 14%, Asian, 1%, Alaskan Indian, Alaskan Native, 1%. That is the race breakdown. Again, the biggest challenge we know has to do with the unknown portion of that data. The deaths linked by race, the mayor has already given you, but there up on the data is the wheel that you can look at, or the pie chart, and unknown is 29%, white 27%, Latinx 28%, Black African American 14%. And again, the unknown portion of that data is really definitely concerning because we don't know what those races are. The deaths the mayor has again talked about, I won't go over that again, but definitely the white 38%, Hispanic 32%, and Black 23%. So what are we seeing as far as the trends are concerned in the city of Springfield? First of all, the statewide positives: Friday, 2,482, Saturday, 2,674, Sunday, 2,076. And so you can see by the data from the Commonwealth that across this Commonwealth there are increases in every municipality. The deaths in the Commonwealth, 10,098. In Hampden County, we had 12,923 cases and 855 deaths. The city of Springfield remains at 133. We expect that is going to change. Our positives are 5,285. And so what we are looking at, the positivity rate in the city of Springfield is 5.3%. In the Commonwealth, the average is around 3%. So as you can see, we are about 2% higher than the average in the state as far as the positivity rate is concerned. In October 26th, there were 313 positives in our city. November 2nd, 437 positives in our city, an increase of 28.5% from the prior week. This week, 646 positive as compared to the 437 last week gives us an increase of 32.5%. Things are going in the wrong direction. Household transmissions or small gatherings continues to be the primary source of infection. Small and large gatherings are another primary source of infection. The number of cases under the age of 50 now make up 77% of the cases. Last week, it was 73%, which is an increase of 4%. So the individuals under the age of 50 has increased by 4%. 26.5% are under the age of 20, which is a 4.7% increase, and 37.6 are between the ages of 21 and 40. Together, under the age of 40 makes up 64.1% of the positive cases in the city of Springfield. 23.2% are over the age of 50, which is a 3.4 decrease from last week. The uptick in cases are experienced across, again, the city of Springfield. 54% of the cases come from 0104, 8, and 9. Last week, that was 55%. 60.8 of the cases in those three areas accounts for a 5.8% increase in our city. Again, the positivity rate in the city of Springfield is 5.3. So what are we doing here in the city of Springfield to try and combat this surge that we're experiencing? We continue to do outreach to our neighborhood councils and civic associations. When we get calls asking for materials or any other support, then we are there to do that. We do have our environmental health team who is on the ground. They are going to businesses. They are following up on all of those calls that you leave us on our hotline to try and ask our businesses to please cooperate, and for the most part, they are. And so we want to continue on that trend. We will continue to be out, not just during the day, but our staff, our dedicated staff, is out in the evening as well, trying to make sure that businesses and individuals are following through. We had a task force. We have a COVID cold weather task force and flu. They will be meeting again this Thursday. The goal is really to make sure, as a municipality and as a city, we are all on the same page and doing what's necessary in order to do mitigation, prevention, and intervention. And so we are trying very hard not to work in silos, but to work across city departments as well as our community partners. We are working to make sure that our students and our staff have what they need as far as resources are concerned in order to be effective. I appreciate the work that was done with Springfield Public Schools. We tested the student athletes, and I believe they have begun to finish their season. There was not, I think there was 2 students and potentially 2 staffs out of over 500 that was tested. That was very low, and so we felt very good about saying we could move forward. Again, I want to thank the superintendent, assistant superintendent, Jeannie Clancy, and Dwayne Early and Mayor Sarno on that concerted effort to get our students to be able to have some measure of normal activity, but the season is probably only 1 more week, and the superintendent can speak to that, but I believe that it's 1 more week or 2 at the most, but that season will end. We have made the decision to close Sear Arena for another couple of weeks, just to make sure that we're looking at the positivity rate in the city and the case rate in the city. We know that sports can potentially be super spreaders. Hockey has had some clusters in the past, and we want to make sure that we're doing everything we can to keep our students and our athletes safe. The governor's order around stay at home is still in effect. Everyone should be at home by 10 o'clock. Businesses, restaurants should close at 9:30 so that individuals can be home by 10. So we should be in our homes from 10 p.m. till 5 a.m. unless it's critical and we have errands or health needs. You know that all entertainment venues, including casinos, museums, salons, gyms, must also close at 9:30. This is important because for the first week, our staff went around and really did more of a cursory warning, asking individuals, and some said that they had not heard about the governor's orders, and so we reminded them about the governor's orders, asked individuals and businesses to cooperate with us, and so far that has been effective, and we are very much appreciative of the businesses. This order is in effect. It can be enforced by Springfield Police Department as well as Health and Human Services staff. The police department is in every public health regulation that we promulgate, and so they have obviously enforcement powers as well. But my staff was out during the evening and checking on stores and asking individuals that we saw, do you want a face covering? Can we help you? So the goal really is to be helpful. The goal really is to ask individuals to cooperate with us. Face coverings are important. The CDC has just released information that says not only does it protect others, but it protects you as well. A face covering, I understand, sometimes can be difficult. It can feel as though it's overwhelming to put it on all the time. But think about what the physician said to you today. It saves lives. We want to make sure that we're doing everything we can to protect each other. The hospital individuals, our hospital workers, I can't even imagine. They're tired. They just spent 8 months, 8 critical months taking care of individuals. That surge that they had in March and April, they are now experiencing again. I cannot even imagine what it must take to get up in the morning and know what you're going to face is devastation and critical care that you must administer to individuals in your care. So please remember the healthcare workers out there. Also, the frontline workers in grocery stores, in businesses, when you're riding the buses. Everybody is putting their lives at risk who performs those jobs, the grocery stores, to make sure that we have what we need through this pandemic. We are in a surge. Please respect the fact that these individuals have loved ones, have families that they want to go home to. Finally, I would say to you that it's important to recognize that individuals who are elders, who have underlying conditions, are the individuals who are at most at risk. We ask that they get flu shots. We ask that they care for themselves. And the numbers in that age group actually went down a little bit. So please make sure that we are caring for each other. I know that I say that over and over again, but this is not the time to be selfish. This is not the time to think about yourself only. There are so many other people that we need to care for as far as this pandemic is concerned. And you can selfishly walk outside. You can selfishly walk into a grocery store and just think, I'm a young person. It's not going to affect me. But I want you to think about those other people who potentially could die because you do not take the time to cover your face. Face covering, social distancing, hand hygiene. The travel orders, New York and DC, have been removed, and so they are no longer a part of the low-risk states. So you must, if you're traveling from those 2 states, you must quarantine for 14 days or have a negative test within 72 hours. So New York, DC, Washington State, removed from Massachusetts list. Stop the spread. AMR, thank you very much. They have tested to date 44,658 individuals. Springfield residents, 18,023. Of that, 2,584 Springfield residents have tested positive over that time period. AMR continues to stand up at Eastfield Mall. Transformative Care, Fallon, is currently at Putnam Vocational. They started on Thursday They will only be there until the end of November. And so the state stood Fallon up in order to help with some of the holiday testing that may need to happen. So they are there. Thank you to Patrick Sullivan for working with them to get that site. Thank you to Superintendent Warwick for agreeing that we could use that site. The neighborhood ambassadors are still there. There are neighborhood ambassadors who are standing up sites in the more impacted neighborhoods, and so that will be on our website so you can see where they are. Standing up means they'll have a table with information on it so that everyone can understand what the preventative measures are, and I know that we know that, but they will have materials. The PSAs, we are working on that now. We do have materials available. We will be putting messages on billboards and buses. I expect that that will happen sometimes this week or early next week. We are talking with the PVTA right now. The mayor has mentioned that the federal government has a role, and he got emotional about it, but it's really, really important to recognize, had we started last March with a national mask mandate, had we started last March with a national testing strategy, had we not said to residents that this virus is not real, that it's going to suddenly magically disappear. Well, we all know that's not the case, so I'm looking forward to the testing protocols that will be put in place, the national mask mandate, or at least requests that will be put in place, because we do need help from the federal level. We are a house on fire and we are burning quickly, and we will be ashes soon unless we get relief. That relief becomes from our behavior. That relief becomes from our ability to test, trace, and contact individuals who we have been around who may be positive. And please make sure that you're complying with our contact tracers. When they call, please answer your phone. There's a lot of individuals we need to contact right now based on our numbers, and so when our contact tracer calls, again, they're trying to stem the tide as much as they can. I am grateful to our environmental health team. I'm grateful to our nursing team. I am grateful to my entire department who really are gearing up again, because we know that it's going to be important that we're out there and doing our best. Thanksgiving advisory, we will be sending that out. I think you know that we ask you to be together in small groups. We ask you to think about going virtual. We ask you to make sure that you're just being with your family if we can. I know we're asking a lot of you this Thanksgiving, but we do this so that we can all hug each other next Thanksgiving. So this is the time to really make sure that you're hunkering down as far as who you have in your environment is concerned. Flu shots, we are recommending again that everyone over the age of 6 months gets a flu shot. We talked about, or I talk all the time about health being emotional, mental, and spiritual and physical. This virus has constrained all parts of our health. People are experiencing normally holiday depression. That's real, that individuals experience holiday depression. Now we have people who are going to get depressed about the holidays. I know for me, since my father passed away, Christmas hasn't been the same, because that was the individual who made Christmas. He loved playing Santa Claus and doing all of those fun things. So during the holidays, I am not up and ready to go most days, because I have this sort of cloud that comes over my spirit. And that happens to many people who have lost loved ones and remember what holidays used to be like. So there's this holiday emotional depression. Then we've got the COVID depression on top of that. Then we've got to stay in the house because it's dark. Then we've got children at home that we've got to care for and who are learning remotely. Then we've got elders in our family who need us. It is overwhelming during this season, and COVID is really just an added layer on top of it. So I recognize, the mayor and I recognize that we are asking a lot of you. We are asking you to be vigilant. We're asking you to stay with us in this fight. And the mayor continues, and he will say it again, we will defeat COVID-19. We cannot be in your homes every day. We cannot be in your businesses every day. We cannot be in your life every day. We can't walk with you on the streets every day. And so I'm asking that you adhere to the guidance. Some of it is very simple to do. Think about saving a life. Wear your mask, wash your hands, watch your distance, and make sure that you are taking care of yourself emotionally throughout that process. Thank you.
Thank you very much, Commissioner Helen Colton-Harris, AKA Dr. Anthony Fauci. And before I bring up the public safety component, the masks. Not going to kill you to wear a mask. God forbid, could kill you if you don't wear a mask. And more you're hearing stories or seeing stories, even on national news, that somebody said, I never thought it would affect me. Never affect me. Never affect a loved one. But it did. Somebody getting sick, or God forbid, passing away. So now's the time to really hunker down and make sure we follow all the public health measures to starve this COVID-19. With that, we'll now have the public safety component. We'll start with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Thank you, Mayor. Good morning, everybody. As the Mayor stated, we have one person out with COVID at the fire department. We have 6 others at this time who are out awaiting testing. Hopefully they'll be negative and we can get them back to work soon. And we have one additional person who had a close exposure who is in quarantine. I just got that on the phone. Other than that, we've had a few small fires in the city this past week, nothing really to speak about. I'd like to encourage everybody to be safe over the holiday coming up with Thanksgiving. Please be careful with your cooking. Try to limit turkey frying. You know, that can always cause a catastrophic incident. If you put a frozen turkey into the hot oil, it can cause a very large fire very quickly. Other than that, everybody have a great Thanksgiving, and that's all I have for this week. Thank you.
Thank you, Commissioner Calvi. And now the perspective from the Springfield Police Department, the Police Commissioner of the City of Springfield, Cheryl Clapper.
Thank you, Mayor. The police department right now, as it was mentioned, we have 20 who are out with COVID-19. They are positive. And then I have about 5 who are awaiting tests. We try to get testing done whenever we can at the police department, and I'd like to thank Patrick Leonardo and AMR and Commissioner Calvi. We've been sharing any resources we have as far as testing sites to make sure that your first responders are tested and safe. I'd like to thank the women and men of the Springfield Police Department. Like the healthcare workers, this has been a long haul. 8 months of COVID-19, 8 months of other tensions, 8 months of other issues, and they show up to work every day and they're doing a stellar job. And I'd like to thank both the sworn and the civilian components at 130 Pearl Street and our other locations. We have gone to one-man cars. This is necessary because of the rise in COVID-19 positives. It's not something that the officers really enjoy. I think they'd rather be with their partners and in two-man cars. In some locations, two-man cars are really called for. We're doing the best we can. I'd like to thank Pat Sullivan for the cleanings and the availability of the chemicals that we need in between the cars coming in and out. As the mayor mentioned, we did have a good meeting with U.S. Attorney Lelling and head of the FBI and local FBI. I look forward to a good working relationship. I put someone back in the FBI task force. With the rise in the guns and the gun crimes, I look forward to them being able to help me out with some sentencing so we're not experiencing the revolving door as we have been. Over the weekend was fairly quiet, but on Friday they did have a good seizure. It was narcotics officers with DEA. Again, it was over 110,000 bags of heroin. It was over $40,000 in cash. And there was 4 semi-automatic handguns. So Captain Keenan, thank you, and to his narcotics officers who continue to do a good work despite all the problems and the stressors. Thank you so much for your hard work. Thank you, Mayor.
Thank you, Commissioner Clapper. We'll now get an update, Springfield Public Schools, from our Superintendent of Springfield Public Schools, Dan Warwick.
Thank you, Mayor. Morning, everyone. To begin with our meals program, very, very proud of our staff with the meals program. We provided 98,596 meals this weekend to families, and our total since we closed down in March is 4,217,506. So staff has done a great job with that. It's been great for the community. As the mayor reported earlier, we had O'Reilly, Talbot, and Oaken come in, Bob Kirshner, and take a look at our ventilation systems. We're working on bringing those ventilation systems up to meet all of the ASHRAE standards, much higher than what's required, but what we should be at in light of this crisis. So we're working on that as we speak. We're going to have, working collaboratively with Focus Springfield, another town hall meeting to get feedback from the entire community on our reopening plan. Right now, temporarily, until we can run that town hall meeting, we're going to stay remote in light of the surge that's going on, and again, everything that's going on right now would lead us to that. But we'll take a look at it and get feedback on that. And of course, returning kids before the ventilation systems are all taken care of would also be something that I think school committee would have serious concern about. We're working with Jeannie Clancy and Helen on our flu shot program, getting information on that. But as of the end of the year, the kids before they need to get the flu shots, and we're working with the nurses. We're going to have a lot on our website about availability of those flu shots, but they're going to be a mandated part of the immunizations like we've done in the past. With the support of the mayor, we've bought iPads for all of our preschoolers. We're still working on the distribution of those iPads, and families who need one can get one at the school, and if not, call the school and we'll actually deliver them to the homes. Helen mentioned this earlier, our sports program with the great support of our health department. We tested all of our fall athletes just to take a precaution because we had a little outbreak. And of all those tests, there were almost no positives in there. There was only a few. So we restarted our fall sports, and that season will be ending at Thanksgiving. Winter sports, we're going to, MIAA and the local Pioneer Valley Association is looking at a delay till January 4th on starting winter sports. We'll be taking a look at, again, the rates in the city, working in cooperation with our health commissioner, and where we're at that time as to whether the school committee wants to proceed with winter sports given what's going on. But that vote will be forthcoming. But again, that winter season, which usually starts right after Thanksgiving, won't start till January 4th anyway. We have a helpline, again, for any family that has difficulty with the online services that is available and on our website. MCAS right now, we don't have an answer for families right now. As it sits, the commissioner is saying that MCAS will go on, but they're taking a look at that. There could be changes. Obviously, there's going to be changes at the federal level. Whether MCAS makes sense this year in light of the learning loss that's going on and the disruption to learning, or whether that time would be better spent on instruction. More news will be forthcoming on that. We don't have an answer. Our staff is preparing to give the MCAS if it's required, but the Superintendent's Association across the state has grave concerns about doing MCAS at this time, especially as a lot of your major districts are in remote education. As you know, we got hit with a ransomware attack. We're in the recovery mode, and we have all our systems for student learning up and running and working well. So we've worked through that attack, and like I say, we're in that recovery mode. Thank you, Mayor.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick. We're now going to have the update from Department of Public Works Director Chris Signoli. Let me just reiterate that we are in need of snowplow drivers. Again, there's license with the CDLs, and when I talk about mechanics, whether at DPW or fire department, these are specialized mechanics or police, license and hydraulics and many of that. So, but if you have those qualifications, we are looking for you. So without further ado, the Director of Department of Public Works, Chris Signoli.
Mayor, thank you. As the mayor mentioned before, DPW has one employee out with a family member with COVID. We will be finishing Friday's yard waste most likely midday tomorrow, so we'll be running at least a couple days behind throughout this week. Make sure that you still have your yard waste out on time as if it's your day. As days get caught up, we tend to start getting phone calls saying, you told us you were 3 days behind, so I didn't put it out. Please make sure you have it out on the day that you are supposed to. A couple weeks ago, we put out a notice regarding some contaminated trash with regard to radiation. We did testing last week in the neighborhood, did not find anything. We have had 2 positive results that has cost the city over $5,000 to dispose of. Most likely in those cases, it is people or animals who are having radiation treatment and then are throwing either medical equipment, we're not talking about pills, we're not talking about drugs, we're talking about medical equipment, diapers, etc., into the trash. So we will continue to look for that throughout the city. As the mayor mentioned, the department has a significant amount of openings that we are trying to fill, specifically mechanics. So if people out there are very interested, the advertisements are up on the city website. We are still looking for plows in the city. Right now we have about 90 in process with the city. We need to have 150 is where we like to be, because we know when we have a storm there's not going to be all 100% of them will not be there. A few weeks ago we were having a rash of traffic controllers getting hit. While that stopped, it's turned into traffic signals getting hit. So over the last week or so, we've had a number of them knockdowns throughout the city that we have had to spend a large amount of overtime addressing. And most of the major construction projects in the city are starting to wind down. Our paving program has stopped for the year. We are still doing sidewalk work, but the major construction projects, Bay and Berkshire, Central Street, etc., will be starting to wind down over the next few weeks. And that is it, Mayor. Thank you.
Thanks. Thank you, Director Signoli. On the Facilities Management and Parks Department, there's Superintendent Pat Sullivan. His team do a wonderful job. Director Sullivan, please.
Thank you, Mayor. We have 7 out with COVID. I also want to thank the Mayor, Finance, and the entire Cabinet for their support as we manage through the COVID crisis. All the items have been ordered to reopen our schools and our municipal buildings, to keep our municipal buildings safe. The carrier units, OptiClean units, and the iWave units should be all in place in Springfield by mid-December. We are starting training this week with our tradesmen to install the iWave units, and we are getting those installed first in our police and fire departments along with the carrier units. I'd like to point out we do have some windows open in here, and I think the city made the right decision to continue with our schools' operations as remote. So the guidance was to have windows open with a box fan with a filter on it. And I just can't imagine children and teachers trying to learn through the winter in those type of conditions. So I want to thank the mayor and Dan and Helen for working with facilities to make the right decision to order these carrier units, because I think it's going to be really the best conditions to learn in as we navigate the virus. Under the advice of our health commissioner, Sierra Arena will continue to be closed for an additional 2 weeks, and we will revisit how we are doing across the city before we open Sierra Arena. And last, I just want to thank the staff of facilities and parks. They have stepped up as we are having outbreaks across our municipal buildings. They step up. They don't hesitate to go in and clean and do what needs to be done to keep everyone safe. So thank you.
Thanks, Pat. Thank you, Director Sullivan. Again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheen and his team done a great job getting money out the door through Prime the Pumps and for businesses and helping out our residents, and we're going to continue to do that to the best of our abilities, and hopefully that federal stimulus package does come in for our residents and our business community. Without further ado, the Chief Development Officer of the City of Springfield, Tim Sheen.
Thanks, Mayor. To date, the City of Springfield has deployed $10,452,942 to assist the community in overcoming the obstacles and challenges associated with COVID. In the CDBG CARES Act, the funding from HUD was roughly $4 million to date. We have deployed $3.6 million. That comes down to $2.2 million for economic development, $791,000 for public services, and $600,000 for job training. The ESG CARES Act funding from HUD was $5,111,942. All of that has been deployed. It's gone, $1.6 million has gone out for homeless operational services. Rapid rehousing, $1,649,000. Homeless prevention, $846,000. And street outreach at $417,000. In addition, we're preparing to close on the first small business assistance financing in conjunction with Common Capital, and we continue program outreach and intake. The workforce technical development RFP is out, and just to give you an understanding of what is happening with the rent and mortgage relief, and this is for the Hampden County and Hampshire County from Wayfinders. In the past 4 to 5 weeks, Wayfinders has processed 2,500 applications for assistance. The spending is primarily on emergency rental assistance. Put that in context, last July through October, they processed approximately $400,000 worth of assistance. In July through October of 2020, they have processed $1.9 million, and they're averaging between 80 and 100 applications a day. So to double down on the mayor's comment, clearly there's significant need out there. Our resources are being deployed and they're running low, and the need is not stopping. So congressional help hopefully will come forward in the not too distant future. Thank you, Mayor.
Thank you, Tim. Thank you, Director Sheehan. Again, you received the financial update and the legal update. HR Labor Director Bill Mahoney gave you, and then Solicitor Ed Pakula. So at this point in time, we'll open it up to any questions or comments you might have from my cabinet heads or myself. Paul?
We've got a question for Commissioner Clapper.
Sure. Commissioner Clapper, please.
Commissioner, the mayor said there might be an issue with the police academy. Can you expand on that?
Yeah, Paul, I reported 20 personnel with positive COVID tests, and 2 of the 20 are actually recruits that are in the academy out at E Street. They were all tested on Friday, and I had 2 positives there. So they're obviously not there. The other recruits are in right now. We are running it, but we are prepared. Should more test positive, or should Mass Police Training Council come in and say, look, you can't continue. We can go to a Zoom type for maybe a week or 2, but obviously that can't continue for too long because there's physical standards that have to be met that we can't do remotely. But right now they're all there physically except for 2, and we are prepared to go to a Zoom should we need to.
And on the issue of assigning officers again to the FBI task force, can you expand on why you decided to do that?
We've been experiencing an uptick in gun violence, and we've been seizing an inordinate amount of illegal guns, as is every city, every major city. When I went to Boston a couple weeks ago, it's not just Springfield, it's all the major cities. So we need help with their sentencing more than anything else at this point in time. Our state courts, whether it's due to COVID, whether it's due to, other issues with who's working and who's not working, it's a revolving door. You see us every week. We stand up here and we tell you about someone that we've arrested for having an illegal gun, and last week, and we arrested them again this week. It's crazy. So federal guidelines seem to deal with those types of crime a little bit more stringent than the state courts. So to have a member of our police department right in the FBI task force, hopefully we'll be able to sentence more people through the federal guidelines.
Thank you, Mr. Patrick.
Well, Commissioner, just to follow, the 20 people that you said were out, you said personnel, are those all sworn officers, or is it just across the entire department's staff?
Within that number of 20, Matt, there's probably 2 or 3 that are civilian workers. We got hit in our garage area, too. We have a couple mechanics out and radio repair, so there are a couple of civilians in that number.
Thanks, Commissioner Clapper. Any other questions or comments? Paul, go ahead.
Just got a quick question for Pat Sullivan.
Sure. Director Sullivan?
This is a non-COVID question. How is the drawdown of Lake Massasoit?
The drawdown's been completed. Last week, because of the warm weather, we did have an exodus of turtles trying to find basically to go about their daily routine, and usually it's much colder at this time of the year, so they would have started their hibernating process. But working with the Mass DEP and our TJO Center, over 30 were captured and brought safe and brought to other areas. So other than that issue, everything has gone as planned.
So everything's on schedule. The actual repair work will start
Next year, so we'll finish our design, go out to bid this winter, and then start in the spring, early summer. You have to do the drawdown at this time of the year just for the wildlife so they can properly hibernate and be safe during that drawdown period.
What would you say to the public as far as accessing the area where the water?
We've posted the public park areas to basically stay off those areas, and I would advise that anyone living along the lake, they shouldn't take that chance. It's slippery. It's some areas you could sink. I think the fire department actually went out to pull somebody out that got stuck in the mud. And the other area is that is the Mill River. It's still actively running. There's areas that are going to be very deep. So we'll continue to post that through the winter, especially in the winter. Don't try to cross the Mill River because that could be 6 to 8 feet of water in that channel, so someone could drown. So we want everyone really staying off those areas.
And has I know it was on TV a week or 2 ago about the cars that were taken out, has other debris being moved? Is there a plan to go in and do some cleanup work?
We're going to be working over the winter. It's not as extensive. There is debris, but it's nowhere near the amount that we had in 1996, 97 when we did the drawdown. So we are making plans, and we will be coordinating that in this late winter, spring. Depends, some of the larger trees we might do in the winter when the ground's frozen, it'll be safe for those that personnel to remove those large trees that have fallen along the edges. But it is our intent over the 18 months to do cleanups. Yep.
Thank you, Director Sullivan. Again, it's not very sexy, but those dams, Van Horn, or whether the Water Shops Pond, Van Horn helps protect Bay State Medical Center, Atwater in the north end, and Water Shops Pond protects Maple High Six Corners. And the south end, God forbid, if they were ever to break, you'd be deluged with millions of gallons flooding those areas. So I appreciate the work that Director Sullivan and Tina Quagliato Sullivan from Timmy Sheehan's shop there on the resiliency grants that we received. Any other questions or comments? Okay, hearing none, I really want to thank, again, the media, the TV, radio, and print media for continuing to get this message out. I want to thank cabinet heads all the way down to rank and file. They have been tested and true through a number of man-made and natural disasters. And I want to thank you, each and every one of you, the residents and business community, for your resiliency, your patience. I know this has been very cumbersome. I know this has been very aggravating, and we've all become very tired. But we've done it before. We need to knock down this surge, and I ask you to be cognizant of that. And please, wear your masks. Again, wearing a mask is not going to kill you. God forbid, not wearing that mask could possibly kill you. I know the holidays are coming up, and we're all getting sick and tired of those air hugs, but you only should be around the individuals, family members, friends who you have been around, and you need to keep those gatherings small, as Commissioner Helen Carlton-Harris indicated, so we can all regroup and rejoice down the road when and we will defeat this COVID-19 coronavirus. 2020 has been it sucked, let's put it that way. 2021 will be a year of good health and peace, but I need each and every one of you to continue to follow the guidelines. And Commissioner Helen Carlton-Harris indicated to you the percentage on the age range, and you see from 50 on down, or 40, really 20, 30, that has really increased tremendously. So to the young people, you are not invincible. And to others, please, we don't want you to become a story saying, hey, I never thought it would happen to me, or I never thought it would happen to a loved one on that. We will continue to coordinate as we do daily with our hospital system, Dr. Kerouac at Bay State and Dr. Roos at Mercy, to make sure if the surge continues that we have the hospital capacity to be able to get the residents the help that they need. We will continue to coordinate with Governor Baker and Lieutenant Governor Polito for any state assets that we might need. And once again, I'm hopeful that the Congress at the federal level really starts to light a fire under you-know-where and get something done here. People are struggling. Businesses are struggling. My Chief Development Officer, Tim Sheen, just told you, we're putting out every dime we can to the residents in the business community. So more than ever, that stimulus is needed yesterday. Also to help local and state governments to plug the holes for the deficit spending we're doing because our residents and business community are in need. So with that, I wish you all good health and go out and have a great day. God bless. Thank you very much.